everybody. Welcome, and thank you for your attention. I'm inviting my panelists from all over the room. I think come join me, Jai, please. Um, and Jennifer and Derek, come and sit with me because otherwise I will feel very, very lonely. All right, thank you very much. So yeah, my name is Tessa Lennemann. I have the honor of moderating this panel today. And we wanted to talk about capacity building in health, recognizing that while digital health is really giving us a lot of opportunities to save resources in developing countries. For example, in Africa, we're expecting that we could save up to 11 billion in healthcare funds if we would actually roll out digital systems. In Asia, I couldn't find respective numbers, but it's understood that the healthcare market will grow by 23% per year. So there's like a lot of demand on the market, and we have to recognize that human resources is the scarce, the bottleneck, which most probably will hamper nationwide implementation. And human resource is, or digital capacity in human resource is relevant for the healthcare sector, and it is relevant for the IT, the tech sector, right? Because you want to have people who can grow the solutions, who can, build them locally, as we heard in the morning, who can adapt, bring in new models. So it is really important. Human resource is really important across the spectrum. And I know that many of you are engaged in working developing capacity, but maybe we all have worked, building different pieces, knitting our little, square. And the question is now, how can we stitch all these activities together, and what should we do to actually, do our best, bring all the resources together and join forces to grow, ICT capacity in health. So with me here, really, I feel key people that have really inspired me in throughout my journey, and I'm just inviting them to, for one, introduce themselves to you as the audience and outline a little bit what so far they have done to build capacity in IT, so that we in healthcare, so that we can build up on that and see where we want to go together from there. So please, I think Jennifer, you can start.
Good morning, everyone. Thank you for this opportunity to share with you. So I have been working in digital health for over 30 years. Some of the things that I've worked on include OpenHIE, which is about building capacity for health information exchange. But what I want to focus on today is I've had the privilege of partnering with GIZ, PAHO, UNICEF, and others on a DIPC project where we were focused on doing some qualitative research to understand capacity strengthening needs, especially of HIS professionals in the field, understand their needs, understand the barriers to capacity strengthening. And within that project, I got to work with partners to develop some key materials that can be shared. But I think one of the things that we learned as a part of that project and as a part of just different work in global health is that if we try to take the end user perspective about capacity strengthening, what we realize is that we haven't made it very friendly for a person to understand what's available for them to build their own capacity. In other words, you have to know who to talk to and where to go to get materials. We've also not made it very friendly for the individual who's responsible for building capacity within their country or their organization. And so I'm really excited about the opportunity. As Tessa mentioned, we've each built a little square maybe of a larger quilt. And if we could work together, I think it would be much easier for individuals to harness the great materials and resources that are out there and be able to move forward faster together. And so I'm really excited about that opportunity. And I'm going to hand it to Jai, who's going to talk next.
Thanks, Jennifer. This is Jai. I would like to actually share from the point of view of a regional digital health network. And AHIN has been like over a decade now, has been focused on like capacity building and training, has been one of the core areas of focus. And then since we actually work, our mandate is to work closely with the ministries of health in the region, the priorities and the choice of training or capacity building is actually linked to what exactly is needed on the ground. So we try to actually often mix and match, and then done a lot of trainings, both in-house prepared or certifications that are available elsewhere, like we have facilitated them. So I would like to actually share from our perspective of like what has worked and what could actually be still be done in an alliance like Stitch, which Tessa mentioned, how we can all bring it together, especially in the trying times currently. Maybe I would stop it at that and then come with the next round of explaining what exactly. Over to Derek.
Thank you so much. That was a very nice abrupt ending. It was just getting to the climax. Thank you so much, Jai. Looking forward to the next round. I just wanted to thank Tessa, and Tessa mentioned that the panel inspired her, but I would like to take that in reverse, that we've been inspired by the kind of momentum that Tessa and the organization have provided. My name is Derek Mnene. I am Capacity Building and Partnerships Head at the WHO, and our mandate is really to support the digital health ecosystem in the journey that they are undertaking, and STICH is one of the areas that we'll be looking at very closely. Our member states, as you could have heard this morning, discussing the extension of the global strategy on digital health. And we've been quite excited by the contribution of all of you in terms of the member states' transformation agenda. Member states have given us 3 resolutions from 2005, 2013, 2018. Inside those resolutions are elements on capacity building and really focusing on the health workforce and the ability to actually engage digitally. The African region actually in 2010 specifically called for the capacitation of the health workers to really move the agenda of that 2010 resolution on e-health. We all recognize that to transform a sector is really 3 things. It's people, it's a technology, and the processes associated with ingesting that particular technology. And so we're quite thankful that this attention is being given, this area of capacity building is being given attention. From our last survey on e-health in 2015, we did see that countries were progressing in other dimensions of the digital health ecosystem. Health workforce capacity building is one of those items that we're lagging behind. And the data that we see in the Global Digital Health Monitor also attests to the fact that countries are succeeding in as far as implementing, interoperability standards, and as far as putting together legislation, but it's really the human factor that is really lagging behind. So at WHO, working with our partners, where we are focusing on really ensuring that we leave no one behind in as far as digital health skills is concerned. We're working on a global digital health competency framework that will articulate the knowledge, skills, and attitudes of policymakers, planners, and practitioners, and eventually, the citizens themselves. And so through STICH, would like to sort of like lay this foundation so that the STICH approach can actually see the light of day. Thank you so much, Tess, and back to you.
Okay, thank you very much. Yeah, so I think you have seen there's a lot also already happening, but there's a lack of, maybe there's like a little bit of coordination missing. So my question is, we are all talking about STICH and stitching things together, and I want you to take this verb with you. So what is it that the added value could actually bring if we join synergies? Because in the end, you want to do this for, an improved outcome and not just because it sounds very nice. So I don't know.
Okay, I guess I'll go first. I think I mentioned the end user perspective, and I think it's really important that we think about that as we try to move forward. And one of the values that I think we could bring is making the information and the training that probably many of you in the audience, as well as those of us up here this morning, many of us have invested in creating materials and or ways forward. But I think being able to have that in a platform or a menu or a central place where it's accessible. So I think about one word as accessible, making things accessible so that individuals and or people in countries and or implementing organizations have the ability to access it and build from there. I think the other word that comes to my mind is I'm going to use configurable or the ability to modify the materials to suit the context. I think that's important. And so those are two things that come to my mind as values that we could bring as we work together, is to make it accessible and also configurable to fit the context.
Thanks, Jennifer. I would like to add on to what Jennifer said. Like, I think to have the content of training contextualized locally is also very important, because some countries that we work with, though we have facilitated multiple trainings that most of them are in English, but there are countries where it is difficult to have for them. So we are also working through the what we call is the AHINS Working Council, where we have official nominations from 15 countries in the region, and then 2 more are likely to join very soon. Through them, we are also trying to actually translate it into the local content, because that's also important. And most of the courses like that also focuses on, say, digital health leadership and things like that. They have certain use cases that may or may not be relevant. I think a regional network like us, like where the value lies, is to bring in that kind of a regional experience or use cases that are more relevant in that particular region or country. I think if that is actually weaved in as part of the the capacity building, I think that's more meaningful. In fact, AHIN has a digital health capacity development roadmap, I would say, for years now. And then that focuses on leadership, scalability, interoperability, sustainability, universality, as well as evaluation and strategic reuse. So we had this roadmap, and then we actually mapped it to existing trainings, including certifications. But then, like, we would like to actually mix and match based on the ground requirements. That's something that I would like to say. And in March, we worked with WHO, where they conducted a series of virtual consultations on the global digital health competency frameworks. We were part of that exercise as well.
Thank you very much. Thanks so much. I just want to compliment that, it was in 2019. I remember when GIZ, thanks to GIZ, by the way, it was in 2019 that we got some resources to do a mapping on who's doing what, where, and how in terms of digital health training. We did a landscape analysis and really discovered the multiple different courses, as Tessa mentioned, that were unstitched. The fragmentation that we saw was quite evident. And so the idea of a global digital health competency framework, which is our contribution to ensure that competency-based certification actually is realized, that foundational piece is what we are working on with the global community, so as to enable different actors to build on top of that particular framework. We're thankful for the establishment of the WHO Academy that should be leveraged in order to sort of like advance this whole idea of competence-based learning. So at WHO, within the global strategy on digital health, we are sort of like using that as a foundation to enable this important agenda of ensuring that capacities for digital health are assimilated with everyone across the spectrum. We do have a global initiative on digital health that we're using as a framework, a home to consolidate partnerships around specific thematic area, including this particular area of digital health transformation. Very important subject, and I would really stress that this partnership that is emerging on STICH, continues to progress, because we see this as the last frontier in terms of getting a balance across the 7 building blocks of digital health transformation.
Thank you. So as we are talking about talent, about human resources, and about getting together or making synergies, it would also be like, we appreciate this panel today to actually invite you to discuss with us what a benefit STICH could be for your setting or for your environment, for the partners you're working with. So I'm inviting now, although if there's someone who would like to comment on this and sort of identify either what kind of courses you actually have already developed, but also what kind of added value could it bring to you and to your work or your partner's work if you would be in like some kind of wider initiative or movement like what we are sort of sketching out for STICH right now. So I'm not sure if there's anyone. Please hold your if you want to comment. Yes, please.
I'll be real quick. One thing that I was saying is, one is the content. another is the delivery. So I was wondering, there are several delivery platforms as well, including something that we are doing. So if there are good content, how can they be adopted and delivered through multiple deliveries? So if there can be a standard of how the content is produced so that it can be consumed by any of the platforms which can then deliver that. So I was just wondering if some work is happening or could be thought of. Thank you.
You want to directly? I think you have another mic.
So I don't think we've been thinking that much about a standard, but more about a way to create an index or a link to content or to make it accessible. So I think there are actually standards for digital training content, but I think what we were just thinking about is being able to have maybe an overarching, I would say, piece of software that could help link users out to the various platforms so that we're not duplicating the content all over the place is kind of the vision that we had, but that vision is very flexible based on what we're able to accomplish together.
Not about the platforms, but what we are trying to do is actually create this training environment in such a way that it is locally sustainable. For example, one of the countries that we are working with, the University of Health Sciences, as well as the technology, so that this training that what we provide is actually absorbed by them and then actually carried on in the local system without being dependent on somebody else coming and doing it. And then we're also trying to create a pool of, we have various communities of practice, whether it is on enterprise architecture or standards interoperability, also digital health blueprint development. So we are forming those communities and getting people, creating a pool of people in the region trained on this so that, they can actually carry on. So they don't need to become dependent on anyone, because that's the only way, because capacity building is continuous and it's a continuous process. It's not going to end. So it's not sustainable unless otherwise, like, somebody picks up in the local ecosystem and carries over. Thank you.
And just in one sentence, I think for our perspective, this is where the competency framework comes in. That sort of like guides what you put on top in terms of what a person is expected to know, to manifest as skills, and also to sort of like advocate for in terms of behaviors.
Hi, I'm Javier Elkin, Head of Digital Health at ICRC, with a question. Thank you so much for these interventions. So training is the beginning of capacity building, but it's not capacity building in of itself, right? So after those trainings, how do you evaluate the actual impact on the system? How do you ensure that something changes in reality after that? And what do you do beyond the trainings to ensure that capacity is maintained over time? Thank you.
I think it's a very interesting and important and pertinent question. We have this, because we have been training this over 12 years now. We found that unless otherwise there are career pathways for them, or after the training, they are actually given an opportunity to put that into practice, it just goes waste. So what we have done in the last at least 3 years is, whenever we seek the nominations from the countries for these various trainings, we actually have a re-entry plan. So after the training, what is that they will do? So we are actually having that in, and then also for example, some of the people who were part of the Digital Health Planning National Systems course, we made sure that AHIN engaged them in our liaison with the country, the ministries of health, and then the projects that we worked. So that's how we actually get them to do something after the training. Thank you.
Last questions, but you're welcome to reach out to us after that. And the ones who are joining online, you're welcome to reach to stitch@gz.de or just write something in the comments. So please.
I'm Medhat Askar from the International Transplantation Society in official relationship with the WHO. And part of our mission is to support transplant infrastructure in different parts of the world. And one of the things we are working on is developing clinical decision support systems. So we are really looking for any partners to support us because, as you mentioned, there is the content and there is the delivery. So we have the content, but the delivery is something we could benefit from.
Thank you. So I don't know if someone wants to comment very quick. So I think, yeah, thank you so much. I feel there's a lot of input we have to sort of understand and learn to really bring our efforts together. And I think to wrap up this session today, thank you very much for joining us. Please reach out to us if you have content you would like to give to a wider audience, maybe to make it also accessible to other settings. Please reach out to Jennifer and supply it. We have some more information as a flyer, which you can access after this session. And if you would like to be engaged, there is, as I said, this email address you can sort of indicate your interest in. It's stitch@giz.de. And we would be really, really happy to sort of get you all together so that we can work on this together. So thank you very much. Thank you, panelists, for this exciting discussions. And yeah, I wish you a nice rest of the day.